Well, this is your Feel Good Breakfast Show, and we always bring you feel good news. Now, having recently commemorated and created awareness around World Health Day, it's frightening to consider that 1 in 11 people will develop diabetes at some point of their lives. And recent statistics reveal that 422 million adults worldwide already have diabetes. Now, it's obvious that it's a very serious condition and it's something that we need to look at. But did you know that diabetes is also something that can develop within your pet? Well, we have all the details and hopefully some remedies too.
Like diabetes in humans, diabetes in cats and dogs can be treated correctly with good quality veterinary care and controlled diet. Pet owners can manage the condition successfully with the help of insulin, which is the case with Frank, a patient of Dr. Brendan Brady.
Frank here is a sort of typical diabetic patient actually. He's 15 years old. We diagnosed him 3 months ago when his owner brought him in because he was really soaking the litter tray. But fortunately he's doing a lot better now. He is on insulin, which the owner has managed to get on top of the daily injections. We're getting him closer to a more normal weight. The Heels prescription food that he's on is really helping with this. He's much more lively. The owner thinks he's a few years younger in fact. And we're hoping that with time, if we can get him to where we want him to be in terms of weight, we might even get away with not needing the insulin injections anymore. There certainly are some similarities between humans and animals. Most of the viewers are probably familiar with humans being classified into type 1 diabetes and type 2 diabetes. In terms of animals, it's perhaps more accurate to differentiate into two groups, one of which is insulin-dependent diabetes mellitus, and then the other one is insulin-independent or non-insulin dependent diabetes. In terms of what we see in clinical first opinion practice like this, the insulin-dependent type is by far the most common in dogs, and sort of 60–70% of cats present like that. That being said, both of these groups' lifestyle is associated with diabetes. In terms of the diagnosis, at the clinic, like any animal that presents to us, obviously we'll start with a good physical exam and a history, and then from there we'll do some basic tests. We'll check the animal's blood sugar, we'll do an examination of its urine. Very often diabetics have recurrent health issues, and we need to make sure we evaluate the whole situation. But once one has confirmed the diagnosis, high blood sugar, persistent high blood sugar, blood in the urine, that sort of thing, then you can proceed with the appropriate treatment. In terms of what you'd see at home in your own pet, increased thirst, increased drinking, and then obviously increased urinations with that. Increased eating. Very often they'll be eating more and in fact losing weight. Here, generally insulin is required, but the other important thing with this is obviously diet, getting the animal to its ideal weight, making sure it's fed the appropriate amount and type of food. Feedings are important in terms of matching them with injections. Like Frank over here, the Heels MD is a very good option. High fat, moderate carbohydrate, or in fact low carbohydrate and moderate fiber. All of that helps to improve the sort of stability of the blood sugar. You don't get big spikes after feeding. So diet, and then finally exercise. The owner needs to remember that it's a chronic condition. The animal's obviously going to have it for the rest of its life. It's something that requires dedication and requires good communication between them and their vet, and regular checkups.
With regular exercise, a healthy diet and careful monitoring, it is possible to have a lively and happy diabetic pet.
When he's healthier, he's happier. And a dog's tail never lies. Give him the science of happy, found in Heels, the brand recommended by vets worldwide.